Hi, YouTube fam. I am Angeline, the nursing assistant. Hi, YouTube fam. This is Saturday. Yesterday, I was so busy. I had to, I went to work, of course. Then I had a doctor appointment. I had to go pick up a rental car. You know, my car is down. I do still have my work car, but I don't want to drive my work car, on this leisure time, on this weekend, me being in the streets. I didn't want to do that. So I had to get a rental car. So that's what I did. So I'm on here on this Saturday making a video for Friday. So this is Saturday, but this is the video that should have been done on Friday. Let's get into it. Today we're going to be discussing what do I need to know about being a nursing assistant. And the reason this topic is coming up because I have some friends, some associates that will come up and say, hey, can you get me a job? What do y'all do? Do you think I'll be able to do it? Because being a nursing assistant, there is a lot of jobs out here if you can be a nursing assistant. And it does take a special kind of person to be a nursing assistant, as I have stated on some of my previous videos. Being a nursing assistant, you have to be able to be personable with a person or your patient, because you are doing some intimate things for these patients. And a lot of people, that's just not their cup of tea. You will be bathing the patient, every part of the patient. You will be helping them go to the restroom. A lot of time, patients, especially in the older population, are incontinent. So if they have a bowel movement, you got to clean it up. So a lot of people cannot do this. So I always tell them, you got to be a special type of person to be able to do this. And if you got a weak stomach, then this probably is not the job for you. And a lot of time when I tell them, hey, you got to clean, if they're incontinent, you got to clean them. If they can't bathe themselves, and 9 times out of 10, if you're working with the older population, they're not going to be able to. You will have to bathe them. They throw up, you got to get it up. Pretty much you're doing all the dirty work. I'm just saying. You got to have a strong stomach because you will see a lot. So if you're not willing, and not even willing, if you're not equipped to handle situation like this, then I would say you probably would not like being a nursing assistant, because you do have to get up and personal with that patient. So I'm going to give you some specific things that we have to do, and you decide whether you can be a nursing assistant or not. Okay? We're going to get into that. Okay, guys, but all of it is not geary and nasty and turn your stomach and all of that. But I'm going to tell you this. When I first got started, it's not a natural thing. It's not a natural thing to bathe someone else. It's not a natural thing to clean a grown person diaper. So let me tell you that. So it's not that you would naturally feel comfortable in this, because I did not. But you will get more comfortable as time goes on. But still, in order to do the job, you got to be able to tolerate it. And a lot of people, like I said, friends and associates that ask me to get them a job, once I tell them what I do, most of the time they're like, no, I can't do it. I can't do that. So if that's your response, then you probably wouldn't be able to do it, because it's not something that you would feel naturally in doing it. But like I said, I will get into some more specific stuff that I do that is not as gloom and glory as that. A nursing assistant also do vital signs. They do bladder scan. They do blood. They have to take blood. If you work in the emergency room, you will have to draw blood. You will do EKGs. You will do bladder training. You would do catheters, in and out catheter, although that is still intimate. So like I said, a lot of our job is very intimate with the patient, and it takes a special person to be able to do it. So if what I told you is not discouraging and you feel like you can do it, then you probably can. You probably can do the job and do it well. So go out, put your application in, and get it started. Get it started, because the more you do it, the more comfortable you get, and the more easier it is to do these things. Subscribe, like, hit that notification bell, because you don't want to miss not one of my videos. Not one. Come on, let's get it started.